And Dr. Gounder, I just want to go back to what Senator Manchin said for a moment, as an illustration for people. Saturday night, he's had people over a dozen, he thinks, senators and maybe a few more people. Let's call it 15 people over outdoors, he says, Saturday night, all vaccinated. And was there a risk? We now know that Senator Graham probably had COVID then. He tested positive for COVID on Monday. It was Saturday night when he was feeling sick Saturday night. What's the threat level at an event like that for vaccinated people?
Lawrence, this is in fact a very low risk event. If in fact all of this was happening outdoors, as we've been told, this was a group of all fully vaccinated people. And the risk of a breakthrough infection, so infection, not disease, breakthrough infection is only 0.01%. Of those who have a breakthrough infection, your risk of disease, hospitalization, and death are much, much lower even still. So this is, in fact, a very low-risk event for all those who attended. I would just add that if you are at an outdoor event where people are very closely crowded together, a sports venue, for example, or Lollapalooza, as we've seen the pictures this week, that would be a different story. But from what we're hearing, this was a low-risk event.
Let's listen to what CDC Director Walensky said today about the Delta variant.
If you get sick with the Delta variant, we estimate that you could infect about 5 other unvaccinated people, more than twice as many as the original strain. In all of this, there is still good news. Our vaccines are working to prevent severe illness, hospitalizations, and death.
What does the Delta variant, what should the Delta variant do to our behavior? And let's talk about both categories, the vaccinated and the unvaccinated, obviously.
Look, the Delta variant is different. I think that's the key takeaway message here. It is more transmissible. If you have the Delta variant, you can infect twice as many people. That's because the levels of virus that you carry in your nose and your throat, if you have the Delta variant, are 1,000 times higher than they would have been with early forms of the virus. So if you imagine you're just carrying with you that much more of the virus, you're sneezing out that much more of the virus, it's going to be that much more contagious to people. And also it may result in more severe disease. We are seeing younger people, even children now, hospitalized and getting quite sick with this. And so this makes the Delta variant a much more significant threat to anybody who is not vaccinated.
We've finally, as a country, reached the level that President Biden was hoping we'd get to on July 4th, 70%. 70% of people 18 years and older have at least one dose of the vaccine at this point. And I want to go back to a statement Lindsey Graham made about this infection that he's gotten as a fully vaccinated person. Senator Graham is 66 years old, and he issued this statement saying, "I am very glad I was vaccinated because without vaccination, I am certain I would not feel as well as I do now. My symptoms would be far worse." Is that message getting through?
I certainly hope it is. You know, by vaccinating people, we're not going to prevent every single infection. Vaccines are not perfect, but they are very good at preventing severe disease, hospitalization, and death. A lot of people compared COVID to the flu early on. To be very clear, COVID is not the flu, but we can turn COVID into something more akin to the flu, more like a regular winter cold through vaccination. And that's the key, through vaccination.